Welcome back to Houston Life. Next month, May, is Neuropathy Awareness Month. And you may be like millions of Americans who are suffering from undiagnosed pain, which is caused by neuropathy. What is that? Well, joining us today on Houston Life is Dr. Ankur Khosla from AK Pain and Spine. You know a thing or two about helping people with pain, especially when it comes to neuropathy.
Absolutely. You know, it's one of these things that kind of goes unrecognized, and people just have to live with it until they realize that there are additional treatment options.
That's pretty heartbreaking. I know for you, you got into the business of helping people with their pain because you had a family member who suffered through pain for a really long time. And that is the case for so many people. They don't realize there's treatment, they don't realize where to start, they don't even know what's causing their pain.
Sure, it's a complicated system. Google can only give us so much, and you know, we rely on our first line healthcare providers to provide us with treatment options. However, some of this is so specialized that you have to get into the weeds and figure out those specialists that have an additional training or understanding of new technologies and new therapies that are available to treat this type of neuropathy.
That makes sense. I mean, I know you do use a lot of new technologies to help people, and I suppose if you're not specialising in it, if you're not staying on top of what's coming through, how would you know? So when you are having someone come through your door and say that they're in pain, how do you know it's neuropathy? How do you know how to treat it?
Yeah, so it's interesting. How do you know it's neuropathy? Defining it as neuropathy is quite difficult to do for the patient themselves. They may not come out and say, listen, I've got numbness and tingling in my hands and feet. It may be something as simple as my legs feel like they're heavy or they feel wooden. It's difficult for me to put sheets on my feet at night. So it's not always just that direct description. Talking to the individual and figuring out a little bit more about what surrounds it can give us a better understanding to lead towards that diagnosis. Now, there may be several causes along the way. One of the most common is diabetic peripheral neuropathy. So in diabetes, we have these large sugar molecules that are floating around the bloodstream, and for lack of a better example, are smashing into those small little nerve endings.
Wow.
Those nerve endings then feel like they are on fire.
That's amazing. I mean, and that's not because your back's out, or I mean, that's actually nerves and cells causing the pain.
Or in Houston, we've got the benefit of working with a large cancer center here. A lot of patients end up with neuropathy or these numbness, tingling, deadened sensations from chemotherapy as well, radiation therapy. So there's multiple causes along the way which can create these symptoms. But once it's done, how do we reverse it, or how do we mitigate it? How do we get a better quality of life?
What are those treatments? Are there different treatments? It's obviously not one size fits all.
Not one size fits all. Of course, there's medications which we can try, but those current medications at best provide 50% pain relief, but with a wide array of side effects: sleepiness, dry mouth, fogginess of thought, weight gain, a lot of things which people aren't really wanting to endure just for a maximum 50% relief.
Oh my gosh, yeah, no. It really is investigative work that you have to do for your patients.
For sure. We'll take a set of labs, we'll get some imaging studies, maybe even a little biopsy if needed to figure out what's actually happening on the cellular level.
How long does it take you generally, I mean, or is that a difficult question to answer, to be able to diagnose neuropathy when someone walks in your door?
With our practice being interventional pain specialists, we're almost the last set of eyes that people will consider. So fortunately, I'm meeting a patient with a lot of data already. Maybe they've already tried a medicine like gabapentin, Lyrica, amitriptyline, these sorts of things to treat those conditions, and they're just not getting the relief they're looking for. So I'm kind of piecing the puzzle together already at the end of the stream, right? Versus if we met them sooner, we could get them relief sooner, and they can interact with their quality of life a whole lot easier.
Oh, wow. So the sooner the better. If you're in pain, it's just worth coming in, seeing you guys, and seeing what could be going on, whether it's neuropathy or caused by something else.
Sure. And there's several treatment options. One could be a simple non-invasive treatment option in which we take a patch. You're familiar with chili peppers.
Yes.
We take the capsaicin molecule out of there.
Wow.
And hyper-concentrate it to an 8% solution. It's on a patch, and we just wrap that patch on a patient's foot for 30 minutes. Neuropathy should decrease by about 30% in 2 weeks.
Really? That's amazing. That sounds very non-invasive. That would be a wonderful solution to have that work.
It's almost like a spa treatment. You come in, you get a foot wrap, you read your book, and you're on your way.
We'll bring that one on. Wow. And then there's other treatments, of course, as well.
Of course. There's lots, we can always then go to the spine and look at ways that we can modulate those nerve fibers. We can look at those peripheral nerve fibers and see how we can turn off the signals from that perspective. So you're right. It's not a one-size-fits-all treatment, but meeting the individual, figuring out what they've tried, and what's going to work out best for them.
That's amazing. And you make it very easy for people to reach out to you, to book that first initial consultation. Of course, if you're a Houston Life viewer and you're watching today, you're in pain, just give AK Pain and Spine a call, because they are offering, for the first 25 callers, that free initial consultation. So the number that you want to call is 281-896-0013, and so that's just making it really easy for you. Of course, if you want to do a little more research, jump online to akpainandspine.com. You can learn more about their services, and they do have locations all over town: the Woodlands, Memorial City and Humble, so making it very easy for you. Thank you so much, Dr. Khosla, for joining us today on Houston Life, and take care of you. Houston Life will be right back.